On the coronavirus front, we have more than 14.9 million cases of coronavirus in the United States right now, and the death count has risen to nearly 285,000 deaths. But I want to start today's show on this important moment that we're seeing in this fight against coronavirus as the first people are starting to get vaccinated against COVID-19. Today, the FDA said Pfizer has, quote, provided adequate information to ensure the vaccine's quality and consistency for authorization of the product under an EUA, that is the emergency use authorization. They are due to authorize the vaccine in just a few days. But I want to dive into this more now with Kathleen Sebelius, the former Secretary of Health and Human Services under President Obama. We also have Yahoo Finance's Anjali Khemlani here for this conversation. So, Secretary Sebelius, I want to start with you. There's been reports that the Trump administration could have purchased more than the agreed upon 100 million doses of vaccine from Pfizer. They had the option as well to purchase 500 million more, but they have not yet seemed to exercise that option, which some folks are saying could place us further back in line. The U.S. government has said that they were being prudent when it comes to this decision. I know that you've had experience with these, large vaccine purchases, these orders and the distributions. I'm wondering from you if this was a good call or if you think that the U.S. government was, as they were saying, being prudent not to purchase 600 million doses of coronavirus vaccine from Pfizer.
Well, it's hard to second guess, and I don't know what the negotiations were. I think hindsight is always better than foresight in these situations. The hope really is, Kristen, we will have multiple vaccine candidates that will be equally effective and be able to target them to the appropriate population. So I'm hopeful that this won't be a decision that will be regretted looking back. The United States, I'm more worried about the United States not participating in any of the global discussions, making sure that vaccine is going to be widely available throughout the world, because in addition to our population, as long as people travel and we get back to travel, as long as folks are not vaccinated everywhere, we are still liable in the United States to have the disease tick up again. So we not only have to look out for our population, and that's about 600 million doses that are going to be needed to vaccinate our entire population, but also be a leader in getting this vaccine quickly to developing countries so that travel and business can resume on an adequate fashion as quickly as possible.
So speaking about that vaccine distribution, as you mentioned, some 600 million doses that are going to be needed here in the United States, since it is, just as a reminder for everyone at home, a two-part vaccination process. 2 shots are going to be required. Now, you oversaw the vaccine purchase and the distribution of the H1N1 vaccine back in 2009. Which had a slow start back then. And I was reading at the time that you were blaming production problems, and there wasn't this same hurdle that we have now with this ultra cold refrigeration that's going to be necessary as a part of this process. Given your experience, I'm wondering what your biggest concerns are that you have looking forward at the vaccine distribution here in the United States, which could start as soon as next week.
Well, my biggest concern is that there's not a clear plan right now with this administration. They push the decision making in way too many areas to governors, and governors are really left on their own. So now the CDC has prioritized populations to at least receive the first very important doses. Pfizer has already backed off what they thought they could deliver by the end of the year. They now have lowered that number. That's exactly what we experienced in H1N1, that the numbers out of the vaccine makers were not intentionally devious, but they were wrong. There will be things that happen with batches. There will be things that happen along the way. What I understand is that governors are now trying to figure out how to get vaccine that may be delivered to their states into these various populations. That's all being left to individual governors to figure out cold storage pathways, to figure out how to get things to the right places. In a small rural state like Kansas, there are some pretty isolated hospitals, healthcare workers, nursing homes. It isn't an easy distribution operation. I think the Biden team has a much clearer plan being developed right now. We had a big problem with getting the vaccine, which we had plenty of, into syringes. It turns out that our bottleneck was really in the fill and finish portion of the vaccination. To get it to the arms of folks, you got to get it out of bigger containers into syringes, get those syringes to the right places, get them distributed. And as you say, this logistical nightmare is made more difficult by the cold storage required by particularly Pfizer. Moderna doesn't have that same level of cold storage, and other vaccines may not. But for the Pfizer vaccine, this is super cold temperatures. It needs to be kept there for the time period or packed on dry ice. But as you look at where people are and where they're living and how to get it there, this is a huge challenge. And right now, it's being left on a state by state basis to figure it out. So think M95 masks, where there was bidding against one another and attempts to get all the same equipment. People are now ferociously going after cold storage containers, trucks, to try and figure out how to get it from place to place. And it would be so much better, and will be better, I think, once we get a national strategy and have the federal government commit to making it as easy as possible to get this vaccine to the people as quickly as they need it.
Secretary, it's Anjali here. I know that Operation Warp Speed attempted to address one of those problems, right? The fill and finish part with the various contracts with the syringe and glass vial companies. But looking forward, we know that the meeting on Thursday with the FDA's Vaccine Advisory Committee is really set to go rather quickly. It seems that some institutions are readying their troops for December 15th rollout of the vaccine in-house in some health facilities. So what should we listen for? What do you expect out of that meeting this week?
Well, I think that, first of all, I will acknowledge that what we are seeing right now is a remarkable step forward, that there is light at the end of this tunnel, that there is a horizon where we can see effective vaccine reaching vulnerable people and stopping this horrific death toll and the economic fallout that comes from the virus. So that's all very good news. The next steps are a logistical nightmare, frankly, because it is a complicated process to get one dose throughout the country. We have complications on top of that. And I would say at every point along the way, however many people there are in a category, there won't be enough vaccine. So we're going to see a situation where governors are going to have to make very tough choices. Healthcare providers are going to make very tough choices. They will not have 100% of the vaccine needed to get all the healthcare workers. So who gets at the front of that line? How is that prioritized? There won't be enough vaccine in the next dose for all the nursing home residents and staff. And I think we need to urge people to be a bit patient, as difficult as it may be. Follow the social guidelines as much as possible. Social distancing and mask wearing could not be more important than right now, because we have months to go before we have an effective vaccine reaching a population sufficient enough to have herd immunity. And ironically, that is what herd immunity is about. It's how many people do you have to vaccinate in order to protect others. And the estimates of the public health experts are in the 65 to 70% range should give us some level of herd immunity in the United States. And that's going to take a while to get to.
Absolutely. I want to pivot just for a quick second to the new HHS secretary pick for the Joe Biden administration. Having been in the position, I know that there have been some comments about the lack of healthcare experience. I wonder, from your perspective, is that really relevant? Should that be something that people worry about?
Absolutely not. I think that, first of all, I would put Javier Becerra's healthcare experience up against lots of us who have served as secretaries. He was a key lieutenant in passing the Affordable Care Act. He's been in the courts defending the Affordable Care Act, so he knows intimately the most important piece of health legislation in the last 50 years. He also has worked in Congress on everything from issues involving immigrant children and families to disparities on healthcare. If you think about what COVID-19 has peeled back about health disparities and shined a bright light on, he is ideally suited to be the secretary in this day and age. He's worked on the opioid epidemic. He has a track record on healthcare mergers, which are seen too often as rising prices and not providing additional access to consumers. So I think and he's run a big organization. I mean, the Justice Department in the state of California is bigger than many states, and governors are often tapped for HHS. But I would say that he comes with management experience, with congressional experience, and with the kind of leadership on key health issues that are so important to people across this country. I think he's a terrific pick for secretary.
Secretary, I want to circle back to something that you were saying just a moment ago. When it comes to the Trump administration and the leadership, or some of the criticisms that you're levying about the leadership, lack thereof, when it comes to their strategy in fighting the pandemic, I know that you've praised Operation Warp Speed, but we've talked to a former CDC officer, Dr. Rishi Desai, and he said flat out that he believes the Trump administration is going to bungle the vaccine distribution. I'm quoting him here, because of their inability to get PPE out to all frontline and healthcare workers. And this is a criticism that you've also levied against the administration. Given all of the hurdles, some of the concerns that you were highlighting just a moment ago, and even some of the criticisms that you were mentioning just a moment ago, I want to put that question to you. Do you think that the Trump administration is going to be able to handle this vaccine distribution, which could be as early as next week? Or do you think that we are going to see a lot of failures in this vaccine distribution? Will the administration be bungling this distribution?
Well, I'm very concerned about what seems to be the lack of a coherent plan. Other than Operation Warp Speed, where the Trump administration put all the muscle of the federal government combined with the innovation and expertise of the scientific community and money behind it, and said, go as fast as you can. Let's get rid of the bureaucratic hurdles. Let's move. That has been a terrific success. They have refused to use the muscle, the logistical strength, the financial leverage of the federal government for any other part of this pandemic response. And that's a huge problem. They do not have a plan right now to use the federal muscle, the federal logistics, the federal government beyond getting the vaccine into states. And then it's up to governors. We've seen that playbook. It is a failure. When the federal government doesn't mobilize PPE and distribute it in a fair and equitable and transparent manner, when the federal government doesn't put in place the right kind of test and the testing protocol and ramp up those tests and distribute them fairly and equitably, I think we may see a repeat of that with the vaccine. Real mishmash of efforts. States are left on their own. Some have resources, some lack the resources. All state governments are struggling right now because of the failure of Congress to push through another relief package. And, the federal government will stand on the sidelines saying, basically, we did our job, our hands are clean, and we got vaccine to the states. Well, that doesn't get it into the arms of the population who needs it. And without that help and support that we cannot count on until the Biden team gets in place on the 20th of January, we may see a lot of missteps along the way.
All right, Kathleen Sebelius, former Secretary of Health and Human Services, as well as Yahoo Finance's Anjali Khemlani. Thank you both for participating in today's conversation.